Hello everybody, my name is Mona. I'm an OT student at Augusta Technical College. Today's session is on ADL self-care and I have put together a Nailcare kit for our clients. OT services are provided for the promotion of health and well-being to those who have or are at risk of developing an illness, injury, disease, disorder, activity limitations, or participation restrictions. Keeping domain of OT such as client factors, performance skills, performance pattern, occupation, context, and environmental factors in mind, I have put together a nail grooming kit for our clients. So let me show you what we got. Educating your client is part of intervention, adaptive equipment recommendation, and usage of training. Guidance and education to family members and caregivers. Educating the client increases collaboration between OTP and client, also transfers knowledge. Increase rapport and client's feeling of control between OTP and a client and decreases anxiety. Another important aspect of intervention is keeping cultural value in mind while customizing treatment program to improve clients' ability to perform daily activities. Handouts, written and verbal demonstrations are a great way to start interventions. Today we have Mr. Z here. He is seeking OT services due to arthritis in his hands and lower back pain.
Due to restrictions, I am unable to perform nail grooming.
For this intervention, the goal is to help loosen stiff muscles, improve finger and wrist range of motion, enhance circulation, reduce trigger points, and reduce edema for functional activity for grooming nails. So in my kit, I have included moisturizer. You have choices here. Heat using pain therapy cream and cold pack. Now be careful with these things when you use it, because if you're not certified in your state, you are not allowed to use it. So check with your boards first. Kleenex, hand sanitizer, nail with soft bristles, cotton ball and cotton pads, edema tape, goniometer, and some stress balls. Can you squeeze this for me?
This hurts.
Okay, no problem. Try squeezing the softer one.
This is much better.
Okay, for patients who have arthritis, you want to make sure that it's to their comfort level. So you have choices in my kit. Thank you, Mr. Z, for participation today. That was our preparatory activity with Mr. Z. Our next intervention is cleaning the nails. Of course, it prevents infection control, gives self-esteem, decreases anxiety, depression by giving self-confidence to perform better in functional tasks. So this part of the kit includes cleaning wipes, sanitizer, reusable plastic bowl, cotton towels, nail brush with soft bristles, cuticle trimmer and orange stick, 3-in-1 foot scrub, adaptive long handle, and weighted handle. Now for adaptive long handles, as Mr. Z said, he has back pain, so his range of motion is not the greatest. So what we can do with that is stick this in here like that, and then he can go down and scrub and clean. Keeping our Parkinson clients in mind, this is a weighted handle. You can always stick this in here and help yourself. For this part of the activity, trimming the nails using different grips like lateral pinch and pencil graft, range of motion facilitation, sequencing, and overall taking care of one's needs. Most of the intervention can be carried out to different functional tasks and performance areas for patients. For example, preparing a meal can be facilitated with range of motion and grip to move around the kitchen, opening cabinet doors and jars, cooking with utensils, of course holding the utensils. So in this kit I have included different sizes of nail cutters, large one, small one with a different grip, and a tiny one. Of course these would take a lot more fine motor skills to do it versus the big one. I also have included electric nail trimmer. It comes with the buffer and the trimmer and an adaptive handle. So for the electric nail trimmer, what you can do is pick a trimmer. This is keeping our CVA patient with one side hemi in mind, or somebody with tremors. Stick it in here, turn it on its own hand, and you can file their nails. And with this custom-made board here, it has a light in it for low vision. Of course, put this on the table while you do the activity and cut the nails. This would also be helpful with patients with arthritis and tremors. This intervention focuses on adaptive ways to achieve functional independence. In this kit, we have included long handle, a weighted handle or a handle with large grip, different types of nail cutters, electric nail filer, non-slip grip pad, custom-made nail cutter board with light, and of course different types of nail polish. OTP help client learn how to respond to a challenge. In this setting, it's self-care by using long handle for foot care, large handles for grip, better grip, nail cutter board with light, and weighted handles. Internally, our clients are learning to master the self-care by evaluating what they learned in therapy. The role of OTP team is to assist in the interaction of the demands of the client's occupation and their desire to master the challenges presented. If a patient is absolutely not happy with their hands, of course they can compensate by using these fashionable nails.